So, welcome and good morning, everyone. We still have a few people and some note takers coming in. So, I want to make sure we respect your time and get started. We have Dr. Roxanne Delgado here. Um, I listened to this conversation that she had, this presentation on caring for the caregiver, and the stats data that she has just blew me away. You know it, but then when you see it, it always, as we know, it makes a greater impact on your mind and my memory. It stays there a little bit better, a little bit. But then I have Roxanne when I have a question. So I want to welcome Roxanne and I thank her for being here and sharing this information with us. And you can share the presentation with us later.
Absolutely. You mean like later?
Yeah, whenever. I mean, now you're gonna
Oh,
share it,
okay. Yeah,
and
no,
then if
no.
you can share it in email or whatever pieces of it, in case
Absolutely.
people want that.
I'm definitely
Okay,
gonna share it. Yes.
very good. Then I am gonna go ahead and pass it forward and mute myself and enjoy this wonderful presentation, guys.
Thank you so much, Alice, and the Sacred team. I'm very excited to be here with you today. I'm gonna be sharing a little bit about, caregiving in our city, some statistics also at a national level. I'm very humbled to be here, and I'll tell you why. You're all very early in the morning. I hope that you stay awake. It is not, and I promise it's not gonna be a death by PowerPoint, but I definitely want you to see the graphics and get to understand a little bit better the life of caregivers in our city and the challenges, but also the opportunities. Sometimes we stay just on the challenges and barriers, but very few times we hear like, what are the opportunities to make sure that we improve their health and well-being. I'm going to share my slides right now. I Once I do that, I won't be able to see your face. I won't be able to see anything. So if you have any questions throughout, the presentation. I don't know if you want to wait until the end. Alice, I would defer that to you, or you can just, speak up and say, hey, stop there. I have a question about that. Okay. So I'm going to go ahead and share my slides. And I need someone to tell me if you're seeing the correct slide or like the slideshow or the other one. Can you see it well?
No, we're not seeing anything yet.
You're not sharing
We
yet.
see you.
Yeah.
Okay, you see me. Let me just go back here. Okay, and now I'm gonna be able to know what you're seeing. So let me just,
There we go.
give me 1 second. Let me just swap.
Yep.
There?
There we go. Perfect.
Yeah.
Better? Okay, perfect.
Yep.
Oh, and I actually can see some of your faces. Yay. Sometimes it doesn't allow me. So anyway, good morning. My name is, again, Roxana Delgado, and I'm going to be discussing a little bit about, caregiving in this state of affairs, like I said. I always have to do a disclaimer because I'm a professor at UT Health, and I do research, and with that research comes from funding from the Department of Defense or Department of War. Now I need to make that edit there, the VA, and some other government entities. So nothing that I said, it's their remarks, but it's all mine. When we talk about caregiving, we hear more likely it's like, yeah, someone's, is a spouse of this person that more likely is going to be 65 years old and older. But the reality is that what we're seeing is a different trend of caregiving in our nation. We're seeing younger caregivers, we're seeing different roles. Now we're seeing a lot of like neighbors taking on the caregiving role, church members, friends. So the definition of caregiving has been evolving throughout the past couple of years, and these are the three most distinct caregiving definitions. So in a nutshell, it could be anyone. It could be a family member. It could be a friend. It doesn't mean that it needs to be a person in a certain age. Even children can be caregivers, young adults, older adults. So you name it, anyone can be a caregiver. And we do know that caregiving is, you're not, let me just break it this way, you're not going to be spared from being a caregiver or needing a caregiver. The reality is that it's like Rosalind Carter, former First Lady, Rosalind Carter said, in this world, there's only four type of people: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need a caregiver. And I wonder, how many of you here have been in any of these four roles. I can tell you that I have been in the role that where I was a caregiver. In my young age, I cared for my grandfather. Remember, I didn't think I was a caregiver back then, but I cared for him with my mom. And every time they were in a hospital and my grandma had a stroke or my grandfather. So that's the early ages where I started being a caregiver and staying overnight in the hospital with him at the age of 13 and 14, just to kind of be there for him. Then in 2009, I was already married. My husband was in the military, and during his third deployment, he was wounded in Iraq, and he was medically evacuated, and that required 3 years of full time rehab. At that time, for those 3 years, I was a full time caregiver, and that is really what opened my eyes into the what things that we don't see day to day, but that really opened the eyes. Being immersed in that community opened my eyes into the needs, but also the opportunities we have to make the life of families better. The statistics are staggering nationally. So the latest report that came out of AARP just came out like 2 months ago. Is the caregiving increase is right now at 63 million caregivers in our nation. In 2020, it was 50 million. So it continues to increase. What we're seeing in the community and demographics is that we're having an older population. So aging accounts for a lot of those, but we also have other chronic diseases and injuries that happen in our community. So 63 million caregivers in our nation. 14.3 million are related or caring for a military or veteran. So that means wounded, ill, or injured veteran of all eras. It doesn't matter. We still have World War II veterans around us, all the way to the wars in Iraq and Afghanistan. And like I mentioned, I was one of them 16 years ago. And I was in my early 30s when I was a caregiver. You also have, grandchildren caring for those who are World War II. So you see, caregiving is not really a one size fits all. And then you're gonna start seeing a cluster of different communities. But the reality is that I like showing these pictures because who would have thought that any of these people are caregivers? You don't know. You see them out there in the community, but not necessarily they will look in a certain way. It doesn't discriminate by age or race or ethnicity or socioeconomic conditions. I do know people who are, they're very well positioned in terms of their resources, and they still have to do the caregiving role in Texas, and this is the part that I take a lot of pride, that Texas has it collects data on caregiving. Believe it or not, there's certain states that they don't know anything about their caregivers. But not only we have data about caregiving in our state, but also at our local level. And one of the things about San Antonio, when we think about the high density of veterans in our community, which is why, of course, it's known as Military City USA. Some years ago in 2017, we were able to establish and name San Antonio a hidden hero city that went through the council, and it passed. And what that means is that there's going to be specific programs and attention to identifying caregivers who are caring for wounded, ill, and injured veterans. Because again, sometimes they're is disguised, they're in the shadows, but also at the same time, we know that there's many benefits that could be available to them. So we and in Texas, in Bexar County alone, we have 148,000 veterans, and more than close to 50% or so have a connected disability rating. So, and when you look at those, then you see a 70% and higher, which accounts for a significant disability rating. So we do have a very nice, in that sense, cluster of different populations of caregiving in our city that makes it a unique opportunity for us to serve in bigger and better ways. I don't know if you have seen these statistics, and it sounds like I added like an extra zero. Somebody told me, you know what? I don't know, that doesn't make sense. Like $600 billion, like that doesn't make sense. Well, the reality is that the services that caregivers are the backbone of our healthcare system. They're unpaid, they're untrained. These are again family members, friends, people who are around others, taking care of their needs in so many different ways. I just cluster them so you see activities of daily living, which requires maybe a bit more heavy lifting in terms of the physical presence. And then there's also the instrumental activities of daily living, which is the day to day, care coordination and medication and transportation of that. When you look at the service that caregivers are providing that is unpaid, it accounts for $600 billion. So that is a significant contribution from our family and friends caregivers in our communities. That's why I say they're the backbone. But that doesn't come without a cost. And that usually the cost is the health related cost to that caregiver. We hear about burnout, we hear about, compassion fatigue and all these different, ailments or, effects that happen when someone is caring for someone. I like bringing this graphic because people tend to think it's only physical. Oh, I'm exhausted. I'm stressed. How I'm going to be able to do the next, and the unpredictability of things. But the reality is that with caregiving, the costs and the effects are all what we call the biopsychosocial effects. So it's physical, it's emotional, social, and believe it or not, it's even environmental and cultural because now people have to change the way of lifestyle they have. They, if someone was very prone to going to church, for example, now they may have to stop going to church. Or if someone was part of social clubs, they had to decline those social clubs. They start getting isolated. That accounts and increase the way that they perceive themselves, the way that they interact with others. That affects their emotional and behavioral health. And of course, it's taxing. It's very difficult for many families and friends to care for someone because of that, financial toll, emotional toll, physical toll that comes with it. In my next slide, you're going to see a little bit of those effects. And these are kind of like all spelled out. I'm not going to read it, but there's some statistics that I find are very eye-opening and that we need to at least, kind of like acknowledge them, especially when it comes to the fear or poor health related, right? Like, caregivers don't feel they're in the best of their health. And that's overall, that's 1 in 5. Um, then we have, 14 million adult individuals in the US that they care for a child. So when we think about caregiving, we think about the older adults, but do we think about the parents who are caring for their children with disabilities, and many of them with significant disabilities? Some children are born with disabilities, but some other children acquire disabilities due to an accident. And an example that I have seen very often, because it is one of the number one causes of disability in children. It's when children drown, but they survive, anoxic brain injuries, cerebral palsy, and some others due to car accidents, so you have that number of children who may acquire or were born with a disability, and those parents are typically very isolated. You also have caregivers who are under the age of 50. So they're in the prime of their adult, life. They have careers. And the question now is how those effects of caregiving are going to affect their retirement and the way that they age themselves. Um, Many caregivers, they have to do different tasks that are more assigned to nursing, but they don't get formal training. And that is why I'll go later, but I'll show you like how we take that endeavor. We want to make sure that family caregivers or friends are trained to be able to do the tasks that they're taking care of. And, one of the things that and I like emphasizing about employment in the workplace, because what we see is that caregivers have to step out of work, they have to leave their jobs, or they have loss of wages, especially when they're hourly paid, and that of course puts a financial strain. And I would encourage, if any of you work with nonprofits, what we're seeing is
I
that
know five
sometimes
listeners.
sometimes we see that the help is provided to the beneficiary, but it does not, but it doesn't extend to the caregiver. Maybe the caregiver is in need of those same services, but they may not qualify because of the age or any other qualifier criteria. So I want to make, this very distinct, because many times caregivers, they have to leave their jobs in workplace, and makes it a bit challenging for them financially and in terms of basic needs. And last but not least is 29% of our caregivers, that's a pretty high number, are caring for two or more people. So that's why we call it the sandwich generation. They care for a child, an adult, and an older adult, or maybe a spouse and an older adult, or any combination of those, but that would be a sandwich caregiver. One of the things that people don't think about caregiving, and when you think about basic needs, is food insecurity. And I don't know how many of you have seen here the statistics in the specifically the caregiver community, but those who are non-caregivers in our city and nation, it's approximately 17% food insecurity. So you find 17% of families are food insecure. When you extract those who are caregiver, is 62%. So it's almost 4 times higher in in the caregiver population than the general non-caregiver population. So that's eye-opening. And if you're working with these families, people with disabilities, chronic diseases, or caregivers, that may be one of the factors that are, or barriers that they're having in their life. I wanted to show a bit of the map, our local map. So this is our Bexar County, and the darker the color, that means that the prevalence is higher. So when you look at the food insecurity rate in our county, you're gonna see those clusters where it's higher than other places. Now, if you go to the census, you're going to be able to see a variety of different maps. And I have done that for ACOG presentation that I did, but I won't bore you with that right now. It will make it too long. But I wanted to highlight the 4 distinct characteristics or factors that if you overlap the maps, you're going to see they consistently have the same coloring. And that would be lower income, higher medical related expenses, higher prevalence of disability, and limited access to adequate housing. Those are 4 factors that will overlap with this food insecurity, and that's the perfect recipe for caregiving. There's some national attention for caregiving that has been given, and in 2022, Congress passed the RACE Act. RACE stands for Recognize, Assess, Include, Support, and Engage Family Caregivers. There's 5 goals, and I'm very proud to say that at UT Health, Caring for the Caregiver program, we are meeting directly 4 of the 5 goals. The only one we're not working like directly is the number 4, ensure financial and workplace security. However, we are part of the San Antonio Area Foundation, caregivers in the workplace, and we're contributing in ways to ensure that employers and the workplace are well equipped to be able to serve our caregiver community. But if you have a time, I would encourage you to go and look more about what the RACE Act is all about, because at the end, in the report, it's pretty extensive, but I'll be happy to share if any of you need to. The link is there, but I can share a bit more if you would like to sit down or me to do a presentation. I did one 3 years ago when it came out at a national level, and we had all the departments of health come in. So there's very distinct ways, but the reality is that this is not for one sector. This includes 32 different sectors that can contribute to making the lives of caregivers better. That would include the corporate America. That would include government, nonprofit. So any of you here in this call could have a role in how we make better the lives of caregivers in our city and in our county. So I am the director of the Caring for the Caregiver program. We are at UT Health San Antonio, or UT San Antonio. I apologize. We just merged, and I'm still have to get used to saying UT San Antonio. But we provide a variety of different services. I would like to encourage anyone in the call or anyone that is listening to this to go and look at our website and see how we can, if you want to refer caregivers to us, We'll take care of the rest. We're part of the ACOG system. We work very closely with many different organizations. We have also been part of the listening sessions and contributed to Sacred. So we want to make sure that all these services, not only that we provide, but that are available in our city, are also included in Sacred, and that there's a way to navigate easily the resources for caregivers. These are all our different services. It's a multi-service program. And we go anywhere from educational programs like the Essentials of Caregiving. We also build relationships between the caregiver and care recipient, like the Memory Cafe. Many caregivers have problems like or they don't know where to access platforms. Believe it or not, we have caregivers that they don't feel comfortable opening a computer, so that's why now we're making them feel more at ease or more easy access to computers through the health digital literacy. We also teach them how to access their medical records, how to do care coordination, make appointments, talk to your healthcare professional. It's kind of like in some ways lessening or decreasing their fear to connect with the medical team. We do some experientials for those who are caring for someone with dementia. We also have others that are outdoors with the botanical garden, like the Grow program. There's I don't know how many of you have heard or known about the Army Residence Community. They have a beautiful campus here in San Antonio, and they invited us to their campus, and we go on a monthly basis. Instead of them coming to us, we go to them because we can be mobile. And with that comes the mobile unit of the nursing school, and we could provide screenings. The students train through the mobile unit, and we have all sort of different services that we can provide. The reassurance program is last but not least, but that's the one that keeps us connected to the caregivers, ensuring that they have the connections to the programs that are in our city and the resources in our city and region. And this is I always say it's small but mighty, but this is our team caring for the caregiver program, and our contact information. Melissa Martinez just started this past Monday, but I will replace as soon as we have a picture of her. We're all fully bilingual except for Micah Wright, Dr. Wright, and Jacqueline Robertson. The rest of us are fully bilingual, so everything that we provide, it can be bilingual. This is my contact information. I'll be more than happy to answer any questions, connect at a later time. And I'm at your service. Thank you so much for making this available. And I hope that, you have any questions. I hope that you have questions. So anyway, I'm going to stop here um, and open it for questions. Let me just stop sharing.
Thank you, Roxanne. That
Thank
was
you.
amazing. Once again, every time I hear it, I learn something new. Um, I don't know about question, but kind of, the light bulbs turning on. Um, when it said that some people know that within 2 years they're going to be caring for somebody. You can see it coming, and I had that experience. And then um it's interesting how the conversation is changing around this. And I think in our city, I know in my culture, it is expected. It's not who's going to care for mom and dad. You already know who's going to do it, and
Correct.
it's expected.
Mm-hmm.
Um, so just the stress of seeing it coming and knowing that you're going to have to somehow make that work, the physical, the mental, the financial cost, the stress starts already when you get that realization of what's coming, and then the no training for it. I know when I cared for my uncle that he'd had surgery and he had a big old wound that they left on the side, that I had to pack it, and I almost passed out the first time the provider came to the house and showed me how to do that.
Yes, the
That I had to pack.
ostomy. Yeah.
Yeah, well, he had
Oh,
what do you call it? Pancreatic cancer. So they went
oh,
in there and did what you call a Whipple, which means they cut out half his guts and everything. And where the tube was taking out all of the pus and everything. When they removed that, they left a gap in him that must have been this deep. To me,
Yes.
it felt like, really deep. So yeah, I told him he couldn't get any sicker. He wasn't allowed to, and we reached my limit. And of course, he laughed like, "Yep, well, I'm out of control
No,
over that."
I get it. I get it all the
Yeah,
time. So it's very nerve-wracking when you are given that news. I always say that I have never met anyone that wakes up that morning and says, "Oh, today I feel like I'm gonna become a caregiver." The reality is that it's usually abrupt. It happens in a clinic when you hear that diagnosis. It happens when someone calls you on the phone saying, "Oh, there was a car accident or some type of accident," or maybe just any other. But it's not like predictable, right?
right,
And
right,
what we're seeing is that those first months, what I call the acute stages of caregiving, are critical. And that's usually not the time they identify as caregivers. The average time for someone to identify as a caregiver is between 5 and 9 months. By then, there's so much happening. There's so much unpredictability. There's so much care coordination. Um, that many times they don't have the time to really stop and seek help or even know where to start, right?
right,
So that's why I feel like that time is very, very important. We did some work with some partners looking at the caregiver journey, which is another completely different presentation that I do, but it's the actual stages of caregiving, and that first phase is called the awareness. And if that awareness, the longer it takes to be aware of being a caregiver, the more it's gonna delay getting into the services. How
yeah,
someone goes to sacred on their own if they don't even recognize that they need the help. So
right.
that is why I say, like, there's a great opportunity we have as nonprofit leaders, government, leaders in this space, where we can, that will be the first, and is part of the RACE Act, is identifying, recognizing those caregivers, and immediately make them aware and plug them in into the services.
Excellent. I see Bill has a question.
Bill always has something to say. So the thank you, Roxana. This was really great. So
Thank you.
Sacred's been kind of working in this space, as you know, around older adults and individuals with disabilities, and caregiving comes up as a huge need through all of those programs. But one of the things that we found that was common, in kind of our observation when people were talking to us about their journey as caregivers, was that the number of things that were kind of life planning type things for themselves that had kind of faded away. So things like, financial planning for their own retirement, things like, how do I, schooling and job training and education and all those things that most of us just that are part of natural lives, right? All faded away because they're just so exhausted and their time is being taken up. So we see where community organizations are coming in to start those programs. So faith communities coming in and offering, daytime respite care, or they're offering, they are using experts and within their congregation to come in and do pro bono financial planning and things like that. Have you seen things like that? And can you talk a little bit about where you see um, support from these community organizations for caregivers to relieve the stress other than the caregiving, right?
Absolutely. And you're right, Bill, and thank you so much for the kind words. But yes, so typically you're gonna see usually churches and faith-based, organizations are the ones who are the first response, right? In our communities. We see it when there's disasters and when there's, things happening. And the same happens with caregiving. What we're seeing is a great number of organizations stepping up. The need is still great. It's tremendous. And we see that some of this, the number one challenge and need that we see is respite care. Just yesterday, I was with someone on the another call in a meeting, and they said, "Okay, so where can we find respite care in San Antonio? There's many places, but then the question is, like, who's gonna pay for it?" And right now, there's a huge, a long wait list for certain places that they cover the respite care. So it's not just about finding the respite care, is how do you afford respite care? And what we're seeing in our families is that sometimes they have to go into second mortgages or like refinance their homes. to be able to work with respite care, independent living, or nursing homes. So where I have seen a lot of work coming from in the faith-based space, Dr. Epps, she's a colleague and she's doing a tremendous job with the faith-based community. NAMI is involved, and I think I saw someone from NAMI here. But the Second Baptist Church, for example, here in town, here in San Antonio, they have taken a stance on this, and they are providing a lot of different services, not only to their congregation, but also to the community. And we have seen it also, for example, Oak Hill Church, they have doing the same. So what we're seeing is that, like you said, all these different institutions or faith-based homes really taking care of their congregation. So that's where I've seen it. San Antonio has 34 senior centers. That is a great place to have also respite care. And I have had the opportunity to discuss with Miss Colorado at the senior centers, and they have a great, robust programs for those older adults that are also caregivers. So that's where I have seen some of the work, and of course ACOG, but the wait list sometimes is what I keep hearing. It's one of the biggest issues. I don't know if I address or answer your
Yeah.
question.
No, I think thank you for that. I mean, this is really, when we look at faith communities that are engaging in human services work, it's where they really shine is in this kind of relationship space, right? It's not a transactional thing, right? It's a
No,
relationship thing. The people in the pews are having this need and the community is really coming around to support them. So thank you for your answer.
thank you. And you know what? I just have to say this because I was saying before we started all this meeting and conversation that I'm very, very proud to say that San Antonio has a very robust philanthropic, endeavor. And I have never seen a city that has so many nonprofits stepping up for the community. No, and I'm not just talking about caregiving, but all different, things that are happening in the community. I have never seen a community that rallies around each other, that they come together, they form coalitions, they form all these collaboratives. And I have to tell you that when we identify San Antonio as is the highest density of veterans in the entire state. And we approach to say, hey, what can we do for the caregivers? San Antonio really stepped in and said, let's make it a hidden heroes city. And that comes with another set of endeavors and initiatives. So San Antonio is really, in the Bexar County, all this area, it's a model. I honestly feel, and I don't know if anybody has said this or has highlighted this, but it is the model for the nation. And I have been around a while, but I've been here. This is home for the past 10 years, and it will be home until God calls me home.
Beautiful. Thank you, Roxanne.
Thanks.
Yeah, what you said with the Hidden Heroes city, that's amazing. And to know that San Antonio, through this effort and everything Anne has worked on, a compassionate city. And not to mention we have great food. And
Mm.
these other things. Um yeah, I have a whole lot else to say, but I'm not going to get on my soapbox right now. But I want to thank you so much. I don't see any other
I see
questions. Oh, no, I do.
Beverly.
Beverly, there you are.
Yes.
I hadn't
Hello.
scrolled all the way up. Hey,
Hello,
Beverly.
Dr. Delgado. As always, I'm so proud of the university health. But I was literally looking just through my board books. And I serve on the board of university health, but what I'm trying to understand is I don't know that we have actually put forth what you're doing. What the information you had is wonderful, but are we helping to fund you all to do kind of an outreach, because the information is great and I'm looking through a paper and I don't see that we're actually funding you all to help like deliver a service, like maybe train different groups, because what you talked about Second Baptist, yes, is wonderful, but I was wondering, are we doing some more things with you, and what else can we do to help push this out more?
Thank you, Beverly. That's so kind. So who are you with? Which organization or?
Well, no, I'm with West Care, but I'm also on the University Health Board.
Oh, okay. Yeah, no. So
That's
we
why I was
rely.
looking to see what we I didn't see this in any of our funding.
Yeah,
Yeah.
no, no. So we rely on grants and philanthropic, of course, support. So we don't have so technically the university is not putting out of the regular, like budgets.
Yeah.
We're working towards that because our work, and I posted our website there. I became the director 2 years ago, and again, it's a very passionate group. Many of us are mostly dedicated to research, and a lot of these services that we provide are additional to our regular research, endeavors. So absolutely, I always say it. We rely on grants and philanthropic support. So we're always open. Just the other day, we were talking to a corporate team, and we said, how can we help your employees, and how we can form maybe a collaborative, right? Because they don't have to reinvent the wheel. We don't want people reinventing the wheel, but how we can come together and do things together. We're very open to do all those things. And I welcome if anybody knows of any grants out there. I'm always writing grants, and my husband knows I barely sleep. So
Well, thank you. No, this
thank
information
you,
is wonderful. That's one of the things that we could certainly get out. The information is wonderful to have you present to maybe some of the other congregations.
Thank you so much. And I posted about our website. I'm going to be sharing the all these slides. You'll have my contact, direct contact. So I'll be more than happy to discuss anything in terms of what we do, how we do it, and how we can work together.
Okay. Thank you.
Thank you. I think Peter.
Yes, Peter.
Yes. Thank you, Roxanne, for the presentation. Great work. Wanted to ask about have you done any work with the CHEST, the Center for Health Empowerment in South Texas? It's a new organization. Dr. Adriana Rocha Garcia, the former councilwoman in District 4, has just been appointed the CEO. And so we're working closely with her on the South Side and the health disparities. And it's a great work that's just launching. We're really integrating it into community. And I mean, I see the work you're doing, and it's such a great need in those communities, and being able to have that type of training, like what Beverly was saying. How do we make those connections in a real tangible way in the community with organizations like that?
So I would love to connect. I have had the pleasure of knowing Rocha Garcia, and Rocha Garcia is right. We have seen each other. We know each other more by face. And every time we see each other, like, oh, here we are again. And I think she also talks about her caregiving journey herself with her father. So absolutely, we're not currently working with CHEST, but I honestly super open to establish anything. We just had that's how Alice came and presented on last Friday. We are we are mobile, so we did a nonprofit training about caregiving at Blueprint Ministries, which is Impresa, right there, right on our. So, and we're trying to really reach out to those communities that are needing. What we find, and this may not be a surprise to you, but it was a bit of a surprise to me. People don't come to the medical center because they get intimidated by the white coats. And I heard that many times when you go to the South Side, and I'm fully bilingual, as you can probably tell. And they said, no, the medical center? Are you kidding me? There's no way you would drag someone to the medical center unless they're needing ER. Right. So we're trying to be more intentional, and we did everything out of Blueprint Ministries. Very generous, CEO, and we're partnering together. We just started partnering 8 months ago, and out of that came out this endeavor that we did on Friday, which was a total success. So thank you, Alice, for bringing the sacred platform to us.
Well, thank you.
Did I answer that? So definitely, yes. You're gonna have my contact there. I can put us on the chat. I'll put it on the chat so you all can have it. Yeah.
Yes, please. And I'll send you information on the summit we're having November the 15th, where we're going to highlight some of that work that CHEST is doing in that corridor. So thank you.
And November is Caregiver Awareness Month.
Yes. Good. Could prepare for that.
Very good.
Hey, Sam.
Thank you,
How you,
Peter.
how you doing? You have a
I'm
question?
doing good, Miss Alice. Good to see you. I'm looking forward to seeing you next week as well at the neighborhood place.
Yeah.
Yeah, I really wanted to make more of a statement than really a question. I used to work for USAA, and I was an insurance agent, for many years, and I was a financial planner for Citibank. And after this presentation, it kind of a light bulb went off in my head, and I thought to myself, we're always talking about like life insurance, right? So in case somebody dies, you can pay off the bills and still maintain, your lifestyle and what have you. But I think we need to educate people in order uh, to start saving money for this type of a time. Because I know my best friend when his dad was going through hospice, and his dad was like extremely physical and and in good shape, but he fell off a ladder, broke his hip, and within 6 months he had Alzheimer's. Within a year he died,
Hmm.
and but he was prepared. And I remember we used to go drop him off at this real nice facility out there, by Cornerstone. And I asked him, I said, man, this is a really nice place, man. I go, how much is this? It was like 8,500 a month. And I thought to myself, who's paying for that? He goes, oh, my dad.
Hmm.
He goes, my dad had a lot of money. He saved, I remember his dad had so much money, he paid off his house, his brother's house, gave a lot, so people like ourselves, and Bill Neely made a really good point, and then that map is a good point of the marginalized, the people that don't have money, we're the ones that suffer the most. And then even Alice made another good point about the cultural piece, right?
Hmm.
Like in our family, my mom just got Alzheimer's and dementia, and she had to move back from Corpus to San Antonio, and now we're all taking care of her. All of us. So some of us have to miss work, and some has to, take her to. Had to miss work. Well, I miss work, but I had to take a day off and work another day and take her to Austin. About a month ago. So now we're all having to juggle, right, and to take care of her, and which is fine because I love the days that I have. Like I cherish those days because I'm busy. All my brothers and sisters are busy working, but that's how we do it here in San Antonio. And we talk about, people that love each other and come together and unite. And that's a perfect example of how, the cultural, the Mexican American community, definitely in
Yeah.
San Antonio, has always done it. So I just wanted to say that. So thank you.
Thank you, Sam. And that's what we're seeing, right, in our community. I'm posting in the chat while you were talking. You said that you were from USAA. The USAA Foundation created a tool, and they've been very supportive of the Caregiver Financial Wellness program, and it provides like handouts. And at some point in time, they had like a helpline so caregivers could call. And I understand that USA is not, for unless you're a member and all that, but it may be that other, industries like other banks would take, a similar approach because everything they made everything available to the public.
Well, I'm a member, and my dad was a member, and my dad passed away now. My mom's, obviously dependent of his, and not dependent, but was married to him. So, would she qualify for this USAA information, or?
Yes, absolutely. The other place that also for anything that is related to veterans, the national organization that works very much with caregivers is the Elizabeth Dole Foundation. They do have, and I have to say, they do have a fellowship program. I was a fellow representing the state of Texas in 2015 and 16, and after that, you're fellow forever. So a lot of the advocacy that happens when it comes to caregiving in our state, I'll be very involved in that. And we're trying to bring as much as possible, right, for our caregiver community. So the Elizabeth Dole Foundation, that would be another one. And right now they have even programs because of the government shutdown. Just yesterday they posted, if you need financial assistance, contact us. And they're and zero red tape, very easy to work with. But even though I say they're a national organization, they have a very strong footprint here in San Antonio. They're the ones who are spearheading the Hidden Hero City campaign, and each fellow can decide which city wants to be part of it. So in 2017, he's like, oh, we need to bring this to San Antonio. So again, the city welcomed it beautifully, and we are in a city that really not only cares for our veterans but cares for the community. So.
And just one last shout out because I know the Veteran Administration, they take a lot of flack, but they were really good to my father, in his days of his needs, especially when he became 100%, disabled. I mean, they really, really, really took care of my father. So a shout out to them and the work that they do as well. And hopefully we get everything back on track with
Thank you.
everything.
No, thank you for saying that. And I know that but if they do a great job, that means that we caregivers are gonna have a better life. And I'll tell you this, my husband and I are here in San Antonio, big part because of the polytrauma and the VA. Here he receives all the care that he needs. He doesn't have to be traveling anywhere. And that's what sustains his health, and he's able to do what he does in the community. And he does a lot in the community. He does a lot in the community, but he's able to do that because of the great care he receives and the amazing relationship with all of you. This is a beautiful community. The other thing that I love about San Antonio, and I'm sorry, I could be here all day talking about San Antonio, but let me tell you this. The veteran community in San Antonio, they strapped their boots and they said, now let's help the civilian, like the general community. That's why I said, when my husband does all the work, he served the community at large. He said, now it's my time to serve my community. And people get surprised about that, but they should not be surprised. And it's beautiful what we see here in the city happening. So the more you take care of the veterans, the people who have chronic diseases, disability, and all that, the better you're making the lives of those who should be or would be caring for them.
Yeah, and the better for our entire community.
Yes.
The ripple effect is magnificent, and I'm sure, comes back tenfold kind of thing.
Yes.
Well, let's see.
And just one last shout out, Alice,
What you got?
to Anne and to Bill and to you all for making this intersection what it's been for the last 5 years. It's been something incredible, and I think it's something that's going to continue to grow. And hopefully, we can network off this and grow off this. It's going to make us not only a compassionate city, but one that's going to shine above all other cities. Because I think, at San Antonio, I think we do really, really do come together as a city. So
Yeah.
Yes.
But it takes these types of conversations to have that.
Yeah, I think a lot of seeds have been planted in these conversations, and
Yes,
it's a
definitely.
privilege to be a part of it. And yeah, we made Anne take the month off, whether she liked it or not, because she's done a lot of really great work. So we'll give her a month. Let her enjoy her retirement. I get to do the easy thing and say, good
Well, you drag
morning.
her back in.
Yeah, and then we'll drag her back in. Get back to work, woman. What are you doing? But I want to thank everybody for being here this morning. Roxanne, thank you so much. Yeah, we had a lot of people. Usually we cut off at 9:30 if there's no questions. I think we could have this conversation. It's just that ripple effect of it, and that thing that says you either will be, you are, or you're going to need one.
Yeah.
One joke between me and my mom, when she had her stroke, she goes, never in my life did I think somebody was going to have one of my children was going to have to take care of me. Because one mama can take care of a lot of kids, but a lot of kids find it difficult to take care for one mama.
Yeah.
And I have a difficult relationship with my daughter. So to make her laugh, I was like, Mom, you don't have a problem. You have got me. I have a problem. Who do I have? And she looks at me. Oh, yeah, you've got a problem. Like, so I need to like rally community so that I know I don't have a problem. But thank you everyone for being
Thank
here.
you.
And yeah, let's continue this. We've got Roxanne's leadership. Thank you very much. Your husband's leadership. You can thank him as well. Sacred is here to connect and support in any way that we can. I always joke, Bill told me I can promise anything. I just can't give due dates. I give Billy a lot of headaches, but that's okay. He's used to it. And we really appreciate you being here.
You're welcome, Alice.
Thank you.
Thank you so much for
lots of
thank you
hugs.
so much for the invitation, and thank you all for all that you do. I'm here at your service. I just noticed my research scientist was on the call, Kayla. So Dr. Morales. So thank you so much, Dr. Morales, for being here. She's my #1 supporter. She never leaves me alone. So
that's excellent.
Thank you,
everyone.
Thank you, Roxana.
Thank you, everyone. Thank you.
And we will see you. Go off, save the world. And we'll see you next week. Thanks a lot, guys.
Bye. Thanks.
Bye-bye.
Bye-bye.
Bye.